Hello, I'm Lisa Tyler. I'm your host of Senior Connections. This television show is brought to you every month by Senior Resources, which is your local area agency on aging serving Muskegon, Oceana, and Ottawa counties. We're here every month to try to navigate what can be a confusing network of services and programs for older adults, their caregivers, and families. And we talk about all kinds of topics. It could be medication management, it can be Medicare, enrolling in programs, information and assistance, or what we're going to talk about this month, we're going to talk about Alzheimer's. And you might recall we did that just a few months ago, but we are going to talk about some exciting programs that our local Alzheimer's Association has coming up in later this month of August and in September. And so my guest today is Tim Breed from the Alzheimer's Association. I'm excited to have you here, Tim. Thanks for joining us.
Thank you.
So you and I have known each other for decades.
Yes, we have.
In lots of different ways, but our viewers probably may not know anything about you at all. So why don't you tell us and me a little bit about you?
Be glad to. I've been in Muskegon quite a few years, as you know. We had a chance to meet very early on in my professional career here, most of which has been in a healthcare setting, primarily a hospital in Muskegon, followed by many years at a hospital in Holland, but have lived in Muskegon the vast majority of that time. So it's been a very interesting field to work in, the field of healthcare, always changing, always new things. And even though I do not have a clinical background, I'm not a physician, don't even pretend to be one, it has given me an opportunity to get close to those individuals who deal with illness and injury, and to get a sense of the dynamics that take place and the need for information, probably more than anything else. And I think that's applicable to my current role, which is now with the Alzheimer's Association in the Muskegon office. I'm a relative newcomer to that, and kind of starting some new things within the office.
So tell us a little bit about what is your actual title there and what kind of work are you doing?
Great. My title is Community Engagement Manager, and it is a little bit of a different position for the Muskegon office. There aren't many throughout the country that are doing this particular line of work. The viewers may be familiar with our program staff who are bringing educational programs and support groups into the community. They may know our fund development people who are helping with our walks and the Walk to End Alzheimer's, and then also the Longest Day activities. My particular role has a few different facets to it. To begin with, I'm really going to be kind of a listening ear in the community. We know, and I think we can honestly admit, that there are a lot of individuals in Muskegon County who we just aren't reaching. They may not be aware of our services, or we may not have a service that's lined up with their particular needs. So a part of my role will be to conduct a series of community forums in different parts of the county. I like to think of them as kind of a town hall meeting, where we provide a little education, but then we get into an open dialogue with these residents to ask them, what is it that they are receiving, what information do they have, but what information is missing, and what types of programs might we bring into their communities to kind of shore that up. And then once we've had a chance to really hear firsthand through these community forums what those needs are, then we kind of change course, and we do our best to ramp up volunteer support that would be appropriately trained, given the proper orientation, place them right back into those communities to hopefully fill those gaps that are out there. So that's kind of where we're going. It's going to take a little while. It's a process, but I'm excited about it.
And this was funded by the Muskegon County Senior Millage?
It is. Right? It is. The Muskegon office of the Alzheimer's Association actually serves 5 counties, Muskegon County and 4 counties to the north. But because my role and my work is funded by the Muskegon County Senior Millage, my focus is just the Muskegon County area.
So it's exciting because I love the Alzheimer's Association and what it does, and we'll talk here in a minute a lot about some statistics and what Alzheimer's is. It's unfortunately growing at just an incredibly fast rate. But what I love about, one of the things I love about it is you don't have a huge staff, but I love that you're talking about using volunteers, because people who've been trained and who've gone through it are wonderful people to get out and talk to people who might be just entering that unknown world of Alzheimer's and other dementias that are related to that. So it's exciting.
What I am finding since beginning this particular position, it really doesn't matter who I'm talking to. I am finding that almost everybody has some type of a personal connection. a grandparent, a parent, an aunt and uncle, maybe even a sibling who is either struggling with some form of dementia, it may be Alzheimer's or it may be a different type of dementia. Alzheimer's dementia is basically kind of our umbrella term for any type of cognitive changes that seem to be on a progression. Within that umbrella, Alzheimer's accounts for probably 60 to 80%. So it's very prevalent, and it's here in Muskegon County. And again, whether it's friend, relative, or stranger at the grocery store, almost everyone seems to know someone, which is encouraging to me because I think these would be the individuals who would be willing to step forward in a volunteer capacity, whether it's helping with our Walk to End Alzheimer's or our Longest Day on a fundraising side of things. But I'm hoping to be a part of our programming.
Good. Yeah. Well, so let's talk a little bit about Alzheimer's disease. More than 5 million Americans live with it. How's that number changed? I remember reading somewhere that somebody in the United States develops Alzheimer's just over every roughly minute or so.
It's roughly every minute that there is a new diagnosis of that. Currently, our figures would indicate about 5.7 million individuals that have the disease. By the year 2050, which may sound like it's a long ways out, but it really isn't that far out. We're only talking really one more generation. We expect that number to grow from 5.7 million to roughly 14 million. And so it's a progressive and fatal disease. There is not a cure for it. There really isn't an effective treatment other than treating some of the symptoms. Hence, there's a real focus on from the Alzheimer's Association to fund and advocate for the research part, while we're also providing care and support for the individuals and their caregivers. And a third little prong to our mission is we try really hard to promote brain health, which sounds a bit obscure, but if you think about the way over the years individuals have been encouraged to improve their heart health and lower their cholesterol levels, well, we believe that there are strong correlations between a healthy heart and circulatory system and healthy brain. Some of the research is leading us to believe that. So we advocate for the healthy brain activities too.
Well, and I just read something in just earlier today about some possible, it's always interesting, there's so much cutting edge research about there being some possible link with cholesterol levels, and I think, and so it goes right to the heart, because of course that's so tied to that. So let's talk about, you already mentioned that dementia is that umbrella over,
correct,
and the vast majority of dementias are Alzheimer's, but what kind of signs are there of Alzheimer's? Because one of the things people don't realize is that it's not, forgetfulness is one thing, but dementia is not a natural part of aging. It's not something you should just expect is going to happen. We used to call it senility. Or we just said, well, grandma's old, that's why she doesn't remember something. Well, we thought old was 70 for one thing, and I don't think
and individuals are living a lot longer, healthier lives, which is a good thing. Yes, Alzheimer's, in terms of symptoms, we actually have a community program, and we will make it a part of the community forums to help people understand the signs that they need to be looking for. Probably the most prevalent thing is having memory loss that actually disrupts your daily living. Now, we all forget things.
Right. Where did I leave my keys?
Exactly. And forgetting things is a part of the natural aging process. But when it becomes so pronounced that it begins to disrupt daily living, tasks that might have been easy to do,
remembering to make coffee, forgetting how to make coffee that you've done every day for 30 years.
So, the memory loss that disrupts the daily living, if an individual is struggling with planning or problem solving, it could be simple things, but to your point, how to make coffee. Here I've got all of the elements of a coffee maker and grounds and water, but I don't know how to put them together. I can't quite. That's significant.
Right.
That is something that's significant. The familiar tasks around the house, whether it's coffee or cleaning or those kinds of things. Confusion about times and places. You're in a setting that maybe you've been in on a weekly basis, and then suddenly you're at that same restaurant and you're kind of looking around and there's that feeling of being unfamiliar, confused about where the bathrooms are. Just those kinds of things. Trouble understanding visual images, spatial differentiations, speaking and word issues. Keeping in mind, Alzheimer's is a disease of the brain. So the types of things that your brain would be normally telling you to do, there is now an interruption in that process. A couple of more quick things on signs and symptoms. Changes in judgment, making poor choices, things that would be unusual for you to make. A withdrawal from social circles, which I think a lot of us can understand, because if I'm struggling to remember your name, I'm not going to want to go out.
Right.
I'm not going to want to socialize.
Right.
And it's important to watch for mood and personality changes. Those can all be a part of it.
So those are, none of those things that you said are something that normally is going to happen with aging. So if you're
Correct.
seeing those signs and symptoms in somebody, you may want to get them to a doctor.
Exactly.
Have that kind of a discussion and
Exactly.
see.
And it's
what might be
important
going
to consult with those who are trained in medicine, in science.
on. We can't diagnose that on ourselves.
It would be difficult, and I don't think it's possible to have an accurate diagnosis without having the medical profession involved. They will have the tools and the tests to be able to give a confirmation.
So we'll come back and talk about some of these other things, I think, but I kind of want to make sure that we've got some time to talk about a couple big events you've
Yes.
got coming up. So we're in August, which is, boy, it's flown by.
Yes.
So one of the big things that has happened for several years, but for the last at least 3 years, I think it's happened, you have an Alzheimer's Research Night that happens at Tanglewood Park, which is where Senior Resource is located, at 560 Seminole Road in Norton Shores. So it's happened every year. I think it was maybe at the community college or something before that, but since
Predates
I've been
me.
at
Yep.
Senior Resources, it has been at Tanglewood Park, so we've been involved in that. So tell us more about that. What's our date?
Yes.
I'm excited
You know,
about it.
this is a great evening to get to those kinds of questions you asked earlier about the research and the kinds of things that are being worked on that we get a little headline here and there about. But the research evening is going to be August 23rd. It's a Thursday evening. As you mentioned, it's going to be at 560 Seminole. It's actually in the Life Circles PACE portion of Tanglewood. The registration, refreshments, all at about 5:30. The program actually begins at 6 and goes from basically 6 until 8 o'clock. And that will allow some time for questions. Now, we have a presenter who has returned year after year, Dr. Bruno Giordani. I hope I have his last name right. Bruno.
Like that good pizza from Chicago.
Giordani.
I always just call him Dr. Bruno because I can never remember his last name.
And I think everybody calls him Bruno. Now, I have never met this gentleman, but every single person has talked about what an engaging presenter he is. He does not speak over your head. He will keep it at a layman's level. He is accessible during and after to be able to ask your questions, and turnout has been outstanding in years past. And so we're looking forward to another great evening on the 23rd of August. We do want to encourage people to register for that because we are providing a small boxed dinner for that. And we want to thank Senior Resources for being a great partner with us, and Life Circles, and also Age Well for being partners with us. But the easiest way to register would be going on to the website of alzheimersresearchnight.org. So alzheimersresearchnight.org, and you'll be able to search up the one closest to you and be able to click and register for that.
Well, I'd really recommend that people come to that. I've gone to it. I think this is probably maybe my 4th year.
I think this is the 4th year that we have been.
This is my 3rd year doing it because I started in 2015. But I think the first year I didn't stay for the whole thing. I went early, but last year and the year before I did. And you're right, he speaks in normal language. It's not a bunch of medicalese like you think.
Right.
But he's always very up on the newest research. And there's a lot of money the Alzheimer's Association puts into research. That's a huge thing that they do
significantly.
nationwide. And it's encouraging to hear this, but it's very easy. It's not all medical professions who go. It's caregivers. They're really encouraged to go and hear what is happening out there. What do you really hope that people come away from?
It's, again, it's, I think, an opportunity to hear a lot of what Bruno has to say about the latest research, but probably to know that whoever is in the audience, whether they be a caregiver, whether they be an individual who's been diagnosed with the disease, somebody in the clinical field, there is a lot of individuals, a lot of people all working on finding a way to end this disease. They're in good company, I'll put it that way. There are so many people who are being affected by this. I think just sitting in the audience and looking around, you're likely to see a neighbor, you're likely to see a friend, and suddenly you realize you're not alone in your questions.
I think that's a really great message. To me, I come around feeling like there's hope because you're hearing that the research is ongoing.
Yes.
And it isn't just, nobody's content to sit and say, oh, well, we learned that last year. No, every year It's something different. And he talks about the plaques and tangles and amyloid and beta and that, and I remember that.
You've gotten pretty good at
I've got the plaques and tangles and amyloid beta stuff. But he explains what all that is.
Right.
And I can't tell you right now because I'm not Dr. Bruno, but it is a really great thing. And I think to get that hope and encouragement, like you said, there'll be resources there because several organizations that will provide information. It's a really great partnership between all of the agencies who are located there at Tanglewood with the Alzheimer's Association, and of course U of M, which is where Dr. Bruno practices and is super involved in that. So again, Thursday, August 23rd, go and you can quickly Google that, call 211, they'll have that information. I know we've got it on our website, seniorresourceswmi.org. We put it on our Facebook page. All of us that are involved in it are all promoting it. So we'll probably remind you of that at the end. So then August, not that I want to rush us along because this has been a glorious summer, but after that, we are into September, and we have another big event that's a first for you, the Walk to End Alzheimer's. So tell us a little bit about that.
And that will actually take place, and this event, it will take place on September 22nd.
Saturday.
Saturday, the 22nd of September. Takes place at Heritage Landing in the downtown area. The walk itself is about 2 miles in length. As I understand, this walk has been held in Muskegon all the way since 2001.
Oh, wow.
So we've got quite a long history. Last year, I understand about 500 people participated in the walk, which was great. And the walk to end Alzheimer's, the Muskegon Walk is one of roughly 600 that take place across the country. This really serves as the financial engine to help fund that research that Bruno talks about. So it is a key component to raising funds to support research, but then also it helps to support those free programs and support groups that the local office brings into the community. So there is a portion of it that remains right here and funds the kinds of support and information that we provide on a local basis, but it also helps to fuel that research portion.
Great.
So.
Do you remember how much was raised last year? I know you weren't there, but...
No, I don't. I believe that the goal for this year is $80,000.
Okay.
So it's a rather progressive
event,
goal, and we hope that we would be able to do it. I understand, I think we have about 140 individuals so far signed up. It translates into about 30, 35 teams. And I think the key part of that is having a team of people that can help you go out and raise those dollars and participate as a group and do some unique things in fundraising.
Well, Senior Resources, along with AHL Services, has one of those teams. Life Circles has one too, and we're a little competitive in our building. So last year it was just Senior Resources, Life Circles, and we were excited because we raised more money than our friends at Life Circles. So this year we invited AHL Services to join us in that. So we do things all during the year.
You have some type of a pizza?
We have all kinds of things. We did a give back day from Chili's last week, or just recently we did that. We sell pins and bracelets, and we have different fundraisers. We've done a canvas painting night. We do it really during the year. It's a primary thing our community outreach committee supports because, of course, we're serving older adults.
Perfect.
They certainly by no means do they all have that, but it's certainly because it's something that is more likely as we grow older. That it's something that we're very, very passionate about.
Age is kind of the leading risk factor.
Yeah, it is, unfortunately. So we've been doing it for a while, so we'll have a team there. I've done it for the last couple of years. It's a lovely walk, too. It's easy. It's flat. I remember last year was horribly hot. You know how September can be in Muskegon. And it was a really, really hot day, so I was very glad that it was flat. But it's pretty much walking down Western and through town.
Yeah, and
you can stop at the chalets and shop.
I was going to say, it's important to stress, this is a walk. This is not a competitive run.
Right.
You don't put
it's
chips
not a 5K,
on people.
It's walk, and we all talked, and then, go out for breakfast if you want to afterwards. So I really encourage
I appreciate your help with that.
So I know that recently there was a national conference about Alzheimer's.
Yes.
I remember reading about that. Anything new? And I know Dr. Bruno will probably talk about anything, but anything you're aware of?
Bruno will cover that. There were a couple of headlines that really kind of made the national press. There is some research being done around a drug that and I need to stress this, it's a very, very early stage outcome on the use of this drug that would indicate that it could help to slow the progression of the disease. But again, I will stress the fact that it's only in the very early stages. It's reason to be hopeful certainly. But it isn't something that you're going to see on the store shelves in the immediate future. Probably the piece of news that I picked up on and others have looked at too is there is much stronger correlation now, as I mentioned earlier, between heart health and brain health. In some studies that were done recently, individuals who were able to keep their systolic blood pressure, their upper number of their blood pressure, the top number, if they could keep that at 120 or lower, that seemed to have a real impact on lowering the risk of developing Alzheimer's disease. So again, the body is one system. If you treat one part of it well, you're probably treating more than one part of it well. So based on what we're hearing early on, healthy lifestyle, diets, exercise, doing what you can, and medication included, to keep that systolic number at 120 or lower. Again, the early studies would indicate that's a very positive step to take towards offsetting Alzheimer's.
So another reason, if you've been diagnosed with high blood pressure, to think about getting a medication if you can't do it through diet or exercise and that, because it doesn't matter whether it's a natural way that you're dealing with it or whether you're taking medication. So it's fascinating, really, to find out. I mean, you're right, everything, we're all interconnected inside, but to find out that what you do for one part affects up here, which makes sense because this is pretty much where everything generates.
Absolutely, absolutely.
So another reason to take good care of your body, not just because it's the only one we've got, but it houses some pretty important gray matter up there. That
it really comes back down to probably a lot of things we knew at a very basic level many, many years ago, and it's hard to sometimes stick with those programs, but yeah.
Well, that's encouraging. So it's always great news when you hear about even just something that might be 10 years away from really being on the open market, but that they never stop trying to find something. You've got some pretty amazing researchers.
And again, with the number of individuals that are projected to be impacted by this, and these are just the individuals with the disease. If you take that out to the caregivers who are impacted by an individual who might be suffering from dementia, the impact is on an even larger number of people.
When you're talking, 14 million people that may be...
Plus caregivers,
plus
and
family,
health system
and the health system, exactly, because, you hate to bring things down to dollars and cents, but when you're talking health system, sometimes you are. The financial impact this is going to make on people is devastating.
Absolutely.
Because you can live for quite a long time with Alzheimer's.
Yes, you can.
Yes, it's fatal, but you can. I have a friend in California who is a dear friend who, she doesn't have Alzheimer's, she has dementia with Lewy bodies, but she was diagnosed with that 10 years ago when she was probably 60 or so. That's just not old. And now she's not able to be at home. So now you've got a huge financial impact on your family, because people will frequently try to keep somebody home as long as they can, but there are safety issues and all kinds of things, and sometimes people have to continue to work because this will happen too early, or because we are living longer, sometimes financially we need to work a little bit longer. So the impact, and then we see hospitals are going to shrinking the number of beds, and you don't want to have somebody there for a long time, but sometimes, it's a huge ripple effect. It's going to be way more than those 14 million people that are affected.
It's a major wave that we need to get ahead of, and hopefully research will get us there prior to that. But again, it falls back to us as individuals. What can we do now for ourselves? What can we do for our family? But for the greater good, how can we contribute? How can we support that work that's being done? So a good starting point, whether it's coming out to an event, coming out to research night, just get a little closer to the topic. Learn a little bit more about it. Find out. See if it piques any curiosity. And then, you might be motivated.
That's a good point, because it's not like you can say, okay, if you do A, B, and C, you're going to stave off that Alzheimer's. There's nothing that we know will do it. But in general, pay attention to the other things that are good for your body to be healthy, and you probably are going to have a positive impact on the brain activity as well.
And hopefully for the people around you too.
Right. So, but there are some medications that are effective at helping treat it. It's not a cure, but there are some things that are going on that help stave off the
Well, the focus in medication seems to be more on treating symptoms. There are a few products out on the market, and I don't want to advocate one over the other, but some that have shown that it helps improve memory or keeps memory intact a little bit longer, helps to kind of diminish maybe a few of the signs of dementia. Again, by no means should any of that be interpreted as a cure, because there is no cure for this. It is a progressive disease. It will have a fatal ending until more research and more breakthroughs come down the line. For those that might be a little bit curious about that, or more than a little bit curious, maybe they've got a loved one they're caring for, that is a conversation to have within the medical profession, to start with the family physician. There may be a referral to a neurologist who may have a little bit more insight on the medication options that are out there. But it is really about symptom treatment at this point.
Symptom management more than anything else.
Yeah.
So what kind of advice, if you've a family member or a caregiver and somebody's newly diagnosed, what advice do you have for them? I would guess it's to call you. Call the Alzheimer's
Absolutely.
Association.
I am just amazed and thrilled at the same time about the wealth of information that's available at people's fingertips, whether it is in our Muskegon office or on the national website. It is so well thought through. There is information on practically every topic, every angle of it, whether you are an individual that might be diagnosed or have worries about that, or if you're a caregiver, there is support for you as well. Practical advice. The staff within the Muskegon area, and this is true for regions throughout the state and throughout the country, but we do provide care consultations for those who would just like to have a personal conversation, one-to-one with someone, to give them a little bit of advice about what steps they need to take, whether it's for themselves or for a loved one. What are the things that you want to anticipate? I guess the message that I've alluded to this a little earlier, no one should feel like they're alone with this. There are so many people impacted by it, either with the disease or as a caregiver, and we want people to reach out, to understand they're not alone. We're here to support them. You're here to support them. They've got a community that is willing to support them.
There are support groups available.
Yes.
So let's talk quickly. We've only got a couple of minutes left, but that's some of the things that your colleagues do. They will do one-on-one educational sessions. Let's talk a little bit about the availability and how they find out about that.
At Tanglewood, and most people know where that is, the third Tuesday, there is an individual available on appointment to be able to sit down and again, talk a little bit about that care consultation, what should be expected, where can individuals go for more support. We do have a few support groups within the Muskegon area, a few to the north. Part of our work in the months ahead is to see which communities would want to have more in the way of support groups and find the volunteers by going to the main website of the Alzheimer's Association, or by calling 211 locally, which is alz.org, by entering a zip code. It will very quickly tell you where you can find meetings that are set up, where there are educational programs.
So you can do that for a family member from long distance and put that in. So alz.org is where you want to do that. So I think that's a great resource. So we've got 1 minute left, they just told me. So if you had one piece of advice, would that be it, to go to that website?
I would. I would encourage those who are kind of on the sidelines, maybe they've got concerns for themselves or a family member. There's a wealth of information out there. Tap into it. Call a number, talk to a neighbor, talk to a physician, go to the website, alz.org. There is just no end to the amount of support and information that they can be provided. And it can be done from the convenience of home. Right. So don't sit in silence and suffer and worry. Step up, but they have to take that first step, make that call.
Well, that's great advice for us to end on, and if you can't remember that phone number or the website, you can always call 211 and they can help connect you. I want to thank you for joining us this month. This has been great information. You can also find this on our website, seniorresourceswmi.org. We always archive the copies of the episode, and you can find that information. We'll see you next month. Thanks.